Morning, it's Alex Byer, and today we're going to talk about a couple things having to do with long-term care and planning for the time that we might need it someday, or even a loved one, something like that. So, someday all of us might decide to get old, and or possibly a loved one, a spouse, or somebody we know, a parent. They might decide that they need to get old, and they might need assistance with some of their daily activities that they're doing, their medications, their cooking, cleaning, bathing, things like that, things that maybe we can help with some of the time, but we can't take care of it all the time. So when those times come, there's certain options that we have and certain things that we can do, but then sometimes there's a time when we can't take care of it all by ourselves anymore. We can't take care of it for ourselves, or we can't take care of it for that loved one that we talked about. So obviously, when if somebody that we loved, they say they get dementia or Alzheimer's, or they just can't take care of themselves normally, there's some options that they can do. So sometimes when we age, that there's places like assisted living, RCFEs, residential care facilities for the elderly that you can go into. You could hire somebody to come to your house and help take care of you for part of the day or 24 hours a day. There's skilled nursing facilities that can help take care of you. So there's some options there. Just it depends on the type of care, how much care does it need to be nursing? Do we need qualified people to be helping us out with that care, or and can we afford it in the first place? So a lot of these places you might be looking somewhere between $2,000 to $4,000 to $6,000 if you're going to skilled nursing, something like that. The average private pay that they found in California right now is somewhere around $12,000. And usually when you're looking at the facilities, you might be looking at somewhere between $11,000 and $18,000, which for most people actually is a little bit out of budget. Most people can't afford that, and if you go and ask for assistance from the government, they'll say, sure, we'll help you. Do you have any assets? Oh, you have a house, you have bank accounts, you have these other things, you have rentals. So tell you what, if you just spend down your estate, spend all your money, go on a 6-month cruise, go enjoy yourself when you have $2,000 left in the bank, something like that, then come back and talk to us, and we will, we'll help you out. And most people, they've worked hard their whole lives for whatever they have, and they don't want to just go waste their money and to go get the care. So they'll use it for the care, spend down their estate, and when they've got nothing, then they can apply for assistance from the government through Medi-Cal specifically, and get that assistance. However, there are other options. Obviously, some people, they're going to plan ahead of time, and they might get something like a long-term care policy where you're going to pay into it over time. Over a number of years, you'll build up some money in there, $50,000, $100,000 or more, into a long-term care policy. And then if you needed the care in any type of home, then they'll go ahead and pay you back that money, and so for your long-term care purposes. But a lot of people, they haven't done that planning, or they don't have that, or just the funds run out at some point. So what can people do in that situation when they need the care, when you're taking care of a spouse and you can't lift them up anymore, you can't take care of their bathing, you can't take care of their needs in using the restroom and cooking and cleaning. Taking care of yourself is sometimes already difficult at that point. So when that happens, there's things that we can do with certain trust and planning that we don't need to spend down the estate. We don't need to worry about Medi-Cal or the government coming back and taking our home if they're going to give us benefits at some point. There's certain strategies they can use. When you put things into our trust, that helps with the home. There's certain things that they can move properly, legally, using the rules that Medi-Cal, which is it's Medicaid in every other state. California is special, so they use their own rules and call it Medi-Cal. It's a joint effort between the federal government and California itself. But when we do some strategic planning, we're able to generally move things out of the spouse or the person that needs to go into care, move them out of their estate, so that we're not technically wasting our assets, but we are doing certain things, gifting in a specific way that the law allows us to do, and making it so the person can then qualify based on their assets to get some assistance from the government to help pay for that $11,000 to $18,000 a month costs for care. So these things would apply more to something like a skilled nursing facility. They don't work with assisted living. They don't work with the RCFEs. But so it's somebody that actually needs the care. And once we take some time to figure out what's needed, what the assets are, how things can be transferred either between spouses or into what we call a special type of family special needs trust called the Family Needs Trust, where we can do certain types of gifting to move assets into another entity that is solely for the benefit of the person that is going to go into the home or into the care facility. And once that's done, they can qualify based on their assets because they no longer are going to get excluded, and they won't have certain waiting periods that they would normally have to be subject to if they were just gifting in a normal way. If you just gave everything away that you had, you'd be disqualified for a certain amount of time. So by doing that, we're able to help clients qualify for Medi-Cal assistance and get the care that they need.